The ethmoid bone is another one of those really deep bones of the cranium that we are not really going to see by itself. It's better identified by some different landmarks in the nasal cavity as well as that anterior cranial fossa. So let's take a closer look at the nasal cavity and see if we can get a little more specific here. So the nasal septum is going to be part hyaline cartilage and then two bones that we see here. So we're not going to ever see the cartilage portion when we look at the skull. But this skull has a nicer nasal septum here. So basically we're seeing two bones here. The upper portion is going to be part of the ethmoid bone, and this is called the perpendicular plate. So this guy here, that goes really deep. You can see it goes back very far, all the way to our nasopharynx. And then this bottom portion here is a little slip of the femur. Now that one also goes very deep. So this is forming the division between our left and our right nostrils, or nares. So those are the two bones of the bony nasal septum. And then we can also see our nasal conchae here. So remember, the inferior nasal conchae are paired bones. They're facial bones. So those guys, you can see 1 and 2. And then we can also see our middle nasal conchae. If we go really far back here, and I'm trying to shine light on it, 1 and 2. These are our middle nasal conchae. Now we do have superior nasal conchae, but they are not likely to be viewable from an outside perspective. So that means I can't ask you it on a lab exam. The last part of the ethmoid bone that we can see is from an interior view. So if we come up to our anterior cranial fossa, we've got this little projection here called the crista galli. For Latin, that is literally crest of the rooster. So I guess it kind of looks like a rooster's comb. But this is our crista galli. And then we have these tiny openings here. These are our cribriform foramina or ethmoid foramina. Those terms are interchangeable. And these are going to allow fibers from our olfactory nerve, cranial nerve number 1, to enter into the skull and become the olfactory tract. So overall, this entire area is called the cribriform plate. The openings are the cribriform foramina. And then this is our crista galli.